Does your patient have groin pain that just won't go away? It's very likely that you're dealing with a case of pubalgia, a condition that affects many athletes and active people, and is often related to repetitive hip flexion movement. The problem is that many times you're not evaluating what really matters. Even though the pain is obvious, its origin is not always clear. There may be hidden muscle imbalances, such as poor activation of the rectus femoris or overload of the adductor longus, which cause traction and friction on the pubic area. If you don't detect them in time, these imbalances perpetuate the pain and prevent a full recovery. The good news? You can identify and fix it in real time. Thanks to surface electromyography, you can objectively assess how these muscles behave during hip flexion. This way, you can identify compensations, adjust the treatment, and reduce the risk of relapse. Do you want to learn how to identify these patterns in your patients and use data to decide which muscles to work on? Schedule a free call using the link in the video description. It's a one-on-one call just for you, only 10 minutes, with no obligation and completely personalized. In this post, you'll learn how to assess the synergy between the rectus femoris and adductor longus using surface electromyography, and how to use that information to design more effective treatment plans for your patients with groin pain. During hip flexion, the rectus femoris should be one of the main muscles involved. It's one of the muscles that lifts the leg and generates most of the movement. The adductor longus, on the other hand, acts as a stabilizer and synergist. Ideally, this relationship is demonstrated by the rectus femoris activating more than the adductor longus. When this synergy is disrupted and the rectus femoris doesn't activate enough, the adductor longus takes on an excessive load to compensate. This sustained overload can cause irritation at the common insertion of the muscles in the pubic symphysis, increasing the risk of pubalgia. Now, you're gonna learn this with a real clinical case. During a supine hip flexion test, we analyzed the activation of the rectus femoris and the adductor longus in both legs using electromyography. Take a look at the results. In the left leg, the rectus femoris is activated more than the adductor longus. That's normal synergy. However, in the right leg, the painful side, the adductor longus is activated more than the rectus femoris. There's an imbalance. Pubalgia is associated with a deficit in activation of the right rectus femoris and compensatory overactivation of the adductor longus. This pattern creates constant overload on the pubic insertion. What should you do after detecting this alteration? Once the altered pattern is identified, you can plan a more precise intervention. Here are some key points for therapeutic management. For example, targeted activation of the rectus femoris. Design hip flexion exercises that isolate and progressively activate the rectus femoris, avoiding dominant participation of the adductor longus. You can use electromyography as biofeedback to help the patient visualize in real time whether they are activating the correct muscle, facilitating motor relearning and improving exercise effectiveness. You can correct the technique of global exercises, movements like lunges, step-ups, or running, and check if the activation pattern remains dysfunctional. Therefore, pubalgia is not always just a structural problem. Many times, it is the result of an inefficient muscle pattern. Evaluating the synergy between the rectus femoris and the adductor longus will allow you to identify these imbalances before they become chronic or complicate recovery. If you want to improve your assessments and communicate better with your patients, surface electromyography will allow you to analyze what can be seen and make more precise clinical decisions. See you in the next post.